So mommy makeover, you do a lot of them. What
Yes.
defines a mommy makeover?
Yeah. Well, in a mommy makeover, we are trying to correct the physical changes that pregnancy has done to a woman, especially if she's had multiple births. There's a lot of changes that happen. Top to bottom, face, body, everything. Okay, the facial things change. A woman is not sleeping well. You can see on her face. The breasts after breastfeeding lose volume, lose projection, change shape. Sometimes they end up not symmetric. The abdomen stretches beyond belief. They end up oftentimes with stretch marks, loose skin. The rectus muscles are moved apart and they cause a ballooning of the abdomen. So no matter how much diet and exercise a woman can do, there's just some things she will not be able to fix on their own. And so a lot of them bring in their husbands, and the husband says, oh, you just need to work out a little bit harder. It doesn't work like that. And it's okay to want to look better, get your confidence back, look like you used to look before you had kids.
And you can accomplish that.
We do it all the time.
So you do a combination
Yeah.
of lipo, like for the abdomen.
Yeah.
Combination liposuction, tummy tuck.
Yeah.
Is that right?
We oftentimes do, and most women do need some degree of liposuction somewhere because hormonally a woman changes, and now there's fat where there used to never be fat before. Maybe the outer thighs, maybe the love handles. We need to hone that down. We need to sculpt it. We make it more beautiful. And oftentimes, if you just do a tummy tuck and no liposuction, it's like having a cake with no icing.
Right.
Yeah, it's okay, but the icing makes it so much better. And when we combine the two, and by the way, a lot of surgeons don't combine the two. They want to do one and then the other. We've always done them together, and it can be done very safely.
And you have your own ORs. I mean, they do the operating. It's right there.
Yes.
And an overnight facility.
Correct. We have a nationally accredited OR. We have another physician who's a board-certified anesthesiologist that puts our patients to sleep. We don't use nurses trained in anesthesia called nurse anesthetists. We have an anesthesiologist on board.
Now, you know, I said at the top of the show that you're the go-to guy in North Carolina for these body procedures, for breast lifts, tummy tuck. I mean, you do a lot of them.
Yeah.
Is that right?
Yeah. I've been doing a lot of them since the mid-90s. I just love doing this kind of surgery. It's just so rewarding because we change people's lives so dramatically.
When should somebody do it?
When a woman looks in the mirror and says, I'm not happy with the way I look, I want to be able to get back into a tight dress, or I want to be back in a two-piece swimsuit, or I want the fullness regained of what I had before, or I want to be able to have the lights on when I'm with my husband at night. These are all great reasons why women should say, you know what, now it's my turn. Let me do something for myself. Let me get my body back. Let me get my confidence back. Let me feel good about myself again.
And when it's all done, you
Yeah.
say you see huge changes.
All the time. You can tell when they come back for their 3-month follow-up, they're different people. The way they dress is different. Now they've got form-fitting clothes. The way they walk in and feel like they own the place, they just are different people. It's hard to describe, except you can just feel the energy that comes off of them now. They just have a confidence that they didn't have before. Now they feel like they felt like before they had kids. They're back to that, in some cases even better than that. Okay, because now they're in a different age category, and they look, compared to their peers, now they look even better. And people have said to them, wow, you look great. You know, and who doesn't want to hear, wow, you look great? You know, it builds you up. It makes you feel good about yourself.